It's Fox and Friends.
God love you.
You're going to love our final hour of Fox and Friends today.
Well, right now, there are 135,000 nursing jobs sitting empty. Can you believe that? And by the year 2015, that number is going to skyrocket to 683,000 jobs. That means good luck getting the attention you need if you find yourself in the hospital. So what's driving this critical shortage, and what can we do about it? Joining us with some answers, international nurse and educator and founder of Vigilance Healthcare, Peggy Tallier. Good to see you this morning, Peggy.
Good to see you.
A lot of people do not know about the crisis that we are facing. When you look at those numbers, it's staggering. Why do we have a nurse shortage?
Well, there's several reasons why we have this shortage, starting with the fact that working conditions for nurses can be difficult and stressful. We also have issues with a shortage in nursing faculty, and there's two reasons for this. The nursing faculty is aging. The average age is 54 years old and a retirement of 62. And there's also other opportunities that are high-paying that lure potential educators away from teaching.
All right, so one of the things that you have with your organization is to go out and try and recruit or at least educate other people in other countries to become nurses. That's wonderful, but then what happens? You can't get them here, right?
Well, there's several issues. To recruit internationally and develop nurses is one solution, and we have a big problem with retrogression and the immigration problems of bringing legal nurses that are qualified and trained into the United States. And the other issue is domestically we have so many issues that need health care reform and legislation to help fix the domestic problem here in the United States so we don't have this nursing shortage.
So you say we need to pass the Nurse Education Expansion and Development Act, pass the Nurse Relief Act of 2009 to allow this process to speed up. Right now, it's a 6-year wait for qualified legal nurses to come to this country.
Yes, this is true, and it's discouraging for nurses in South America. And when you think about the growing Hispanic population in the United States, it just speaks for itself to have bilingual nurses who can come here and deliver culturally competent care.
One of the other things you point out, and this is so important, I was telling you that my 5-year-old daughter says she wants to be a nurse or a doctor,
yes.
And you say one of the most important things is to have a positive light about the image of a nurse. What do you recommend?
Well, I recommend some solutions that I think can help with this issue. I think the first thing is we need to pass this legislation and get people to go out in the public and notify their congressmen and call them and let them know this is an important step that has to help out with the shortage. And the other piece that I think that needs to be addressed is the fact that the nurses trying to come to the United States that are qualified are discouraged because it takes years to wait.
All right, and we do need to get more educators. As we mentioned, 50,000 qualified nursing candidates a year. Can you believe that? In the U.S., turned away because we don't have enough educators to train our own people right here.
Yes, this is true, and it's a concern, and I think it's discouraging for the working nurses because they know staffing many times is insufficient, and it's actually showing diminished nursing care, not purposely, actually showing diminished patient care.
All right, in this economy, lots of people looking for jobs. So if you want to become a nurse, now you know that there's lots of jobs out there. Peggy Tallier, thank you so much. Your organization called Vigilance Healthcare. Great to see you today.
Thank you.